大家好，这里是洛杉矶华人资讯网的直播现场，我是主播莉亚。这人呐，到45岁之后，各种视力问题随之袭来，有些人可能更早，40岁就感觉到了。这除了近视眼，还有老花眼和白内障问题，可以说这是近的看不见，远的也看不清。读书、看报、看手机都有问题，开车更是没法开。那这样的日子呢，您想想。现代人啊都长寿，还要持续好几十年呢。那近视的华人朋友呢，都应该如何选择？老花眼和白内障问题再加上去之后呢，你又该怎么办？那今天我们节目就邀请到的是纽约权威医学专家、哈佛大学博士 Dr. Raymond Fong 邝理中博士来为我们讲解。在节目的开始呢，我们首先来为大家介绍一下 Dr. Raymond Fong 邝理中博士，他是纽约市最大、最负盛名的眼科中心之一 Raymond Fong Eye Care 的眼科诊所创始人。他在 LASIK激光技术还有 EVO ICL 以及白内障多种晶体选择方面有着非常丰富的经验。迄今为止呢，他已经从业43年，累计做11万例的视力矫正手术，是美国眼科领域的先驱之一。上世纪80年代，他以优异成绩毕业于哈佛大学，并且获得康奈尔医学院的医学学位。他的病人不乏政治官员、名流明星等近视者，还有很多病人呢是祖孙3代都在这里做手术。在过去的25年中 ，Castle and Connolly 最佳医生指南通过同行审议和评估，将他评选为顶级医生。只有 7% 的医生有这样的荣誉。另外呢，他被列入到纽约杂志的最佳医生特刊，获得业内的尊重和信任。Hello, Dr. Fong. Thank you so much for joining us today.
Thank you for having me.
Great. We're going to have the second episode, and I think our audience have know about you. But first, could you please briefly introduce yourself just a little bit?
Okay, so as I said in the first episode, I am an immigrant. I was born in Hong Kong, came here when I was 5 years old, grew up in Chinatown. And Chinatown was my home and still is my home to a large extent spiritually, because I feel most comfortable with the Chinese population.
And we know that there are a lot of senior people in Chinese community in Chinatown, and they all have problems, various problems, and cataract is main of them. So what is the cataract surgery, and how does the procedure work?
Okay, so think of the eye like a camera. It has an outer lens, inner lens, and a film. So cataract is a denaturing of the inner lens. Instead of being crystal clear, it turns yellowish or whitish, and that blocks the image from coming in properly. So when cataract surgery, what we essentially do is we remove that lens, replace it with another lens. A crystal clear artificial lens that stays in there forever. You don't feel it, you don't have to take it out, you can't rub it out, and it gives you crystal clear vision.
Right. So I heard somebody talk about the refractive lens exchange, which is called RLE surgery. Is it the same as cataract surgery?
Exactly the same. The difference is that in RLE, you're operating on a very healthy eye.
Right.
So you have to be a little more careful. I don't do RLE just because I am a cataract surgeon, and I know no matter how perfect or how successful it is, there's always a chance that something may happen in surgery. So in RLE, you're dealing with a healthy eye. Okay, you can wear contact lenses or glasses just to have good vision. That's different from a cataract, where there's really nothing you can do except remove the cataract. But there's always risks with the surgery. And with the risks in cataract surgery, you know you're dealing with unhealthy eyes, so you really don't have a choice but to remove the cataract. But that being said, cataract surgery is very, very successful. It's not like when I came out 35 years ago into practice.
Okay.
The surgery is totally different these days. Totally different.
Got it. So if your patients have cataracts, he can come for you for cataract surgery, but he doesn't have the cataract yet. You probably just recommend him to have some LASIK surgery to, do more adjustments on their eyes to do the myopia or presbyopia.
Yeah, you're talking about different age groups also. Laser vision correction, EVO surgery. That's really for 18 to 50 years old. Okay. And cataract surgery is for like 65 years and above. And a lot of people are very nearsighted, 50 or so. It's also begin to develop cataracts. So it's really two different groups of patients that you're really dealing with here. So it's really not, you do cataract or you do LASIK. It's really, you do LASIK when you're young, enjoy the vision. Later on, when you develop cataracts, you do the cataract surgery.
Got it. And you have been in practice for over 35 years and have done over 40,000 operations. Now, how does cataract surgery is advanced?
But seriously, it's a world of difference. When I was in training, people had to stay in the hospital for 3 days.
Right.
And then they couldn't lift or bend for like about 3 months, and they couldn't go back to work for a week. Nowadays, cataract surgery, it's 5-minute, 10-minute surgery. You go home the same day. It's with local anesthesia. Recovery, if you do it correctly, especially with the premium options that we have, you can go back to work within 3 days or even less. Okay, you can exercise within a week, and it's just a totally different. It's a miraculous technology that has advanced so far. I would never imagine that we could do what we do now.
Wow. And I just feel lucky, for people who are going to have the surgery, because you definitely can experience better care than a decade ago. So tell us more about these different lenses. I heard that there are monofocal lenses, there are multifocal lenses, and what types of the intraocular lens, which is IOLs, are available for cataract surgery in your practice, and what visual outcomes can patient expect?
So to step back a little bit, there are actually two very advanced options these days. One is actually using a laser. It's called a femtosecond laser to soften the cataract.
Right.
And what that does is that it makes the surgery itself, which you still have to do, much easier, more rapid, and less chance of complications. So femtosecond laser is the first premium option. And then the second option is exactly what you said. What kind of lens can we put in? Well, you can put in a regular lens called monofocal, and that's covered by insurance. And that gives you good vision. But you still have to wear glasses for distance and near for the rest of your life.
Right.
Then there are the premium options where you can put an HD lens in that gives you distance and near, great distance and near. And for most things, you won't have to wear glasses anymore. And so that's really the premium option we're talking about. For example, my mother,
Right.
95 years old.
Wow.
We implanted a multifocal lens. I have dinner with her in Chinatown every Tuesday. She still yells at me. She still tells me what to do. But she can look at the menu without glasses.
Right. Wow. She's 95 and she can see clear on the menu, those small prints. And also you mentioned about the monofocal lens. It can cover by the insurance. But I know that there are technologies can do that with monovision. So what is the monovision? And how does it help you to get rid of the glasses?
The premium option of the multifocal is actually the best, because that gives you distance near. The other option, monovision, is sort of a fallback. And actually it's for people whose prescriptions are so high that the companies do not make that power of a lens.
Right.
They cannot have a multifocal lens. Or for some reason, they're not a candidate because their eyes are not entirely healthy for that. So we do a little trick, and it really involves very accurate calculations to preserve some of the near vision on one of the eyes, so that one eye sees better for distance, the other eye still sees distance, not as clear, but better for near. And most of the time, in about 95 to 90% of cases, the brain can adapt to both and give you good distance and good near vision. Maybe not as good as a multifocal, but still pretty good. And that's monovision. And typically we do it in people of very, very nearsighted who are not candidates for the multifocal lens.
Right. And for multifocal lenses, there are people considering to have it or not having it because they kind of like have the night driving demand. So how does that?
So again, it's really talking about patient expectations. And there are certain people who, and again, my opinion is different from other surgeons. So multifocal lenses, about 2 to 3% of the cases may have some glare vision or vision at night driving. So one of the first questions I ask is, do you have to drive at night? And if you don't, or you occasionally drive, are you willing to give that up? If their answer is no, I have to drive at night, I don't want to give up night driving, they're not a candidate on the multifocal lens. The other thing also is very important, that you have to have a very healthy eye. You cannot have any macular degeneration or any other problems with the back of the eye, because you need perfect focus on the multifocal lens.
Got it. And for multifocal lens, how much prescription can it cover?
I think right now you can probably cover up to, if you're like a 1500, 1600 myope, you can still have a multifocal lens.
Oh, that's fine.
Yeah,
right. I thought it was like 500 or something like that.
Like 500 is nothing. I'm telling you, 500 in the Asian community is like everybody has that or more.
Right. And the monofocal you talk about, that can cover even more. So how much is that?
That can cover, actually, there's really no limit to it, because if it goes so high, they actually make it in a minus form, and I put those in as well.
Right,
Yeah,
so,
it covers everything.
And could you please walk us through the cataract surgery procedures and, from the examination to the surgery itself, what can patient expect during the procedure?
So there's different ways to do it. There's really very basic ways. What kind of anesthesia would you take? So I do an older way. I actually give what's called retrobulbar. I do, but the anesthesiologist does. What they do is they numb the whole eye.
Is it drops or is it?
No, that's the other way. So one way is topical. You just use drops. I really don't like it that way, although most surgeons do it that way, because you might still feel it a little bit. You also might have to have sedation. Older people's sedation is not as good.
Okay.
I do it the other way with retrobulbar, because I have some very experienced anesthesiologists who work with me, and they're very, very good at giving the block, much like in the dentist's office. So essentially, it's like you go to the dentist's office, you're ready to have a cavity. Do you want the full block, or do you want just a little mild sedation and some topical? I'd rather have the full block. So I do it that way. That being said, the surgery, either way you do it, is a 5 to 10 minute procedure. You go home the same day. You wear a patch maybe for a few hours. The advantage of the topical is that you almost see immediately.
Right.
So the disadvantage of the way I do it is that the first day things will be blurry because your eyes still block. But the next day, same result.
Right.
See very, very well.
Got
so
it.
Mine's the older way, but I feel it's a little safer way, especially for senior citizens.
Right. Because you're a conservative.
And it's all done in a surgical center, not in a hospital.
Right.
It's pretty straightforward. The only caveat is that if you have a lot of medical problems, and that's why I tell people don't wait. Even though it's an in and out procedure, last week I had a case, I feel bad. The person was in a wheelchair, 90 years old. He just couldn't hold still. We basically had 6 people trying to hold him down.
Yeah.
Not that he made any pain, but he just wouldn't follow instructions, and we had to cancel the surgery.
Right.
It's unfortunate because now he's in a wheelchair. He won't be able to see his grandkids, but we tell people the main thing is don't wait so long. And that's true for any disease. Don't wait till it's really, really bad.
Right. So if they're waiting too long, the cataract itself is just so hard and to get it out, because I know that it's kind of like a vacuum.
Yeah.
Just get it out.
That's why the femto part, which again is not covered by insurance, but it softens cataract, makes it so much safer.
Oh.
But also, more importantly, is that people think, okay, I have a cataract. That's all it is. I can take it out whenever. Well, guess what? Maybe you have bleeding in the back of the eyes. Maybe you have a retinal problem. They don't realize that. They come to me, and I have so many cases of that. I say, sir, I can remove the cataract, but that's not going to help your vision because your back of the eye is bleeding. There's bleeding there. So it's really not just a one-stop, I'll take care of this, it'll be fine. There are other diseases of the eye. Glaucoma. Okay,
right.
High pressure in the eye. You think, it's a cataract. No, it's glaucoma. I've seen so many cases of that as well.
Right.
Yeah.
So if they have issues on their retina, and do they need to fix the retina first? Because you're going to do anything on the top of your eye, it doesn't help because you have a retina problem?
Well, actually, so retinal surgeons, a bunch of refer cases to me, sometimes you need the cataract removed first so that they can see clearly into the eye to operate. But the problem is that now it's not just the cataract, it's also retina. So now you need the second surgery. And the second surgery for the retina, if you've had the problem for a long time, it's not as successful.
Right.
It's really, if your vision is getting worse, don't wait. At least go see a doctor so they can diagnose what's going on. And then if it's a cataract, don't wait so long until it could be something else. Or if the cataract becomes so severe, it's hard to remove.
Right. And also, you talked about it a little bit, the recovery process of the cataract surgery. My mom, she had a cataract surgery. It's not cataract surgery. She doesn't have mild cataract, but it's basically like RLE surgery. But she experienced like for 4 to 5 months to adapt because she has blunt vision, what they call monovision as well. So,
right.
so typically, how long for the recovery?
So that's the thing. The difference between laser vision correction in younger people is that you can still have some power to help your near.
Mm-hmm.
In cataract or RLE, you don't. You're putting an artificial lens in the eye, so there's really no proper way to see near unless you have a multifocal lens. I think your mom's case may be a little bit atypical. Again, most people with monovision adapt very quickly to it. But, if you don't adapt to it, you can always touch it up with a laser. Just as you do in young people,
right?
With what's called PRK LASIK, make both eyes for distance, but then you're relegated to wearing near vision glasses.
Got it.
Monovision works very quickly, very well in most cases. There's always differences.
Right, because she can see clear now. She has 20/20 now, but just the recovery process make her worry about, it's just even worse. But actually, it's not. It's just how she adapt, and it just different case by case, I guess.
Yeah, the main thing with the senior citizen people is this vision should be good, but near vision is so important to them. Like, eating the food, going up the steps. Mm-hmm. If they trip and fall, that's really not distant, that's intermediate vision. It's really important to try to preserve as much near vision as you can.
Got it. And you talked about it a little bit, but are there any risk of serious complications to cataract surgeries? I know that all surgery have risks, and how would you address these concerns for our patients?
So again, as in the LASIK episode, I tell them you can go blind.
Right.
Now, in this case, though, there is a higher chance of blindness. There's something called, for example, endophthalmitis, which is an infection of the eye.
Wow.
Can't be treated. So that's one of the reasons in the United States, generally we don't do both eyes at the same time. We do one eye at a time. Because God forbid it's an infection, you don't want to spread to the other eye.
Right.
Okay. So there is a chance of endophthalmitis. It's still rare. I think the last one is 1 in 10,000 cases. And not everyone goes blind from that. We have treatment for that. But there are a higher chance of blindness. Also, because it's really surgery, you're talking about sometimes very complicated surgery, especially very dense, severe cataracts. Things can happen, So again, that's why I caution people: don't wait so long. It's like any disease. You wait till your heart is 90%, all the heart muscle fails. The chance of a triple bypass or heart transplant is much, much less. Mm-hmm. So there are more risks associated with it, but knock on wood, okay, in most cases it'll be fine. And you can, like I said, get great recovery, quick recovery.
Mm-hmm. Got it. And I think it's kind of different with the laser surgery is that if you're just myopia or nearsighted, actually, if you don't want to have the surgery, just wear glasses, that'll be fine. Yeah. Just very hassle. But for cataract surgery, if you just don't take care of it, it's just growing harder, more density, and finally, it's going to cover your vision as well. So,
the New England Journal of Medicine did a study. It's been a 20 or 30-year study. The chance of breaking, of falling and breaking your hip, even if you have a cataract, is 7 times greater. Doesn't have a cataract. So think of, a lot of times the patients come to me and I go, so why did you decide to have it now? Because I told you 2 years to have it. Well, Dr. Fong, I tripped and fell 5 times.
Right.
And in older people, you have hip surgery. It's accessible, but it's not great surgery to have.
Yeah.
To break the bones. Alzheimer's, we think that dementia comes earlier on, okay, because of cataracts. You can't see your surrounding. Okay? One of my first cases was so sad. I was working in a hospital clinic. The staff had the father in the nursing home, and he was getting more and more dementia. He couldn't see. Right. He didn't know who was around him. And I begged and pleaded, please, let me do surgery. No. The man had bilateral cataracts in the wheelchair, couldn't see who, his relatives.
Oh my God, that's so sad. Right, just don't wait too long because you should have a better vision and a better life. Thank you so much, Dr. Fong. 我们请导播老师来放一下我们这个屏幕上方的二维码。那 Dr. Fong 呢，刚刚有介绍到邝理中博士呢，他是纽约最大眼科诊所的主理人，而且呢，他是纽约最负盛名的眼科医生之一。那大家可以扫描二维码来去预约咨询，因为他咨询都是免费的。然后呢，咨询的时候还会带一系列的眼科检查，可能是你这辈子做过最详细的眼科检查。同时的话，在近视方面呢，有 ICL 晶体的一个立刻免检活动，$1500的非常好的一个价格。那同 同时呢，在白内障手术方面 ，traditional 白内障还有传统白内障以及一些普通的晶体呢，都是可以被 insurance cover 的，也就是可以报保险的。那大概率很多保险的项目他们都可以收，那这个呢就是要咨询的时候再问了。如果大家不习惯扫码的话，也可以添加微信号 NYEYES1哈。那这个呢是他们的微信号、小红书号同理，大家都可以在上面去学习有关于眼科的一些相关知识。Thank you so much, Dr. Fong. It's great to talk to you, and thank you for sharing your expertise. And I'm going to see you next episode.
Okay, thank you very much. I appreciate all this.
Right, thank you. Bye-bye.
All right, bye-bye.